Pimples aren't all the same. In fact, most people only know about whiteheads and blackheads, but there are several types, and each one forms differently, behaves differently, and needs to be handled differently. Today, I'll break down every major pimple type, one by one, and explain what makes them unique. By the end, you'll know exactly what you're dealing with on your face and why it keeps coming back. Let's start with whiteheads. These are the tiny white or skin-colored bumps you see mostly on the cheeks, forehead, and around the mouth. Whiteheads happen when a pore gets clogged with oil and dead skin cells, but the top of the pore stays closed. That's why they look like sealed bumps. They don't have a visible opening, so squeezing them usually leads to redness, irritation, and more clogged pores later. Whiteheads form when people have oily skin, who use heavy skincare products, or people who sweat a lot. They're also common if you touch your face frequently or sleep on dirty pillowcases. Whiteheads can stay tiny, or they can turn into larger pimples if bacteria gets trapped inside. They're not dangerous, but they're persistent. The simplest way to deal with them is gentle chemical exfoliation like salicylic acid. Physical scrubbing doesn't help. It makes them angrier. They're stubborn and slow to heal, so you have to be patient when dealing with them. Next, let's talk about blackheads. They're the complete opposite of whiteheads. These happen when the pore is clogged but open. Once the trapped oil touches air, it oxidizes and turns black. So the black thing that you see is just an oxidized oil. Blackheads show up mostly on the nose, chin, and sometimes the back. They're not dirt. They're not caused by poor hygiene. They're simply open pores with oxidized sebum. People with larger pores or oilier skin get more of them. And here's the part most people don't know. Blackheads always come back because the pores that make them are naturally larger and produce more oil. The only long-term way to reduce blackheads is using BHA exfoliants, keeping oil low, and avoiding heavy, greasy skincare. But squeezing them aggressively just stretches the pores permanently, and I know most of the people do stretch them. So please, don't touch or squeeze them. Now let's talk about papules. Papules are the small red inflamed bumps that don't have any pus on top. They feel painful, especially when you touch them. They form when the wall of a clogged pore collapses and causes inflammation under the skin. Think of them as angry whiteheads or blackheads. The inflammation is what gives them their reddish color. They're sensitive, they sting, and they easily turn into pustules if bacteria gets involved. People mistake papules for allergies or rashes because they can appear in clusters. But papules are acne, just a deeper, more irritated form. Scratching or poking them makes them worse because you're basically adding more irritation on top of inflamed skin. Papules respond best to anti-inflammatory ingredients like niacinamide or low-strength benzoyl peroxide. Don't try to squeeze, pop, or hard scrubbing, because they're the sign that your skin barrier is struggling and need real medical care. Now let's talk about pustules. Pustules are the classic pimple with a white or yellow head. They start as papules, but fill with pus when white blood cells gather to fight bacteria trapped in the pore. That white or yellow stuff isn't dirt. It's a mix of oil, dead skin, and immune cells. Pustules can appear anywhere: face, chest, back, shoulders. They're the easiest pimples to pop, which is why people always pop them. And yes, popping gives satisfaction, but it also increases redness, risk of permanent scars, and more breakouts because the bacteria spreads. Pustules are best treated with gentle spot treatments like benzoyl peroxide or salicylic acid. Warm compresses also help them drain naturally. The main thing to understand is that pustules are just papules with pus. They're inflamed, but treatable, as long as you don't attack them. Loving the video so far? Don't be a stranger. Give us a quick virtual high five by hitting subscribe. It instantly adds you to the crew and helps us make more content just like this. Now let's move into the deeper, more serious acne types. Starting with nodules. Nodules are hard, painful lumps under the skin. They don't have a visible head. They don't come to the surface, and they don't drain. They form when a deep pore becomes severely clogged and inflamed, often because bacteria and oil get trapped far below the surface. Nodules are firm to the touch and can last weeks or even months. They don't respond to typical acne products because the problem is too deep. Applying creams on top won't reach the inflammation inside. If you try to squeeze them, they won't get squeezed, and trying to do so will bruise the skin and cause long-term scarring. Nodular acne is usually linked to hormones, genetics, and chronic oil buildup. The only effective treatment is prescription-level ingredients like retinoids or professional help. Now let's talk about cysts. Cysts are even deeper and more severe than nodules. These are soft, painful, swollen lumps filled with pus beneath the skin. They look like big, swollen bumps that hurt even if you don't touch them. Cystic acne forms when the pore becomes clogged deep inside and triggers a strong inflammatory reaction. The cyst becomes filled with fluid, bacteria, and immune cells, and that can spread, creating multiple cysts in one area. Cysts often leave scars and dark marks because they damage collagen underneath. They're common on the cheeks, jawline, and chin. Skincare products alone rarely fix cystic acne. It usually needs dermatologist intervention. What makes cysts scary is how deep they are and how long they stay. You can't pop them, you can't drain them at home, and squeezing them causes permanent scars. Now let's talk about fungal acne or malassezia bumps. This isn't a true acne, but it's often mistaken for it. Fungal acne or malassezia folliculitis shows up as tiny, uniform bumps, usually on the forehead, hairline, chest, and back. They itch, cluster, and they don't behave like normal pimples. These bumps are caused by yeast overgrowth, not oil-clogged pores. Sweat, humidity, tight clothes, heavy moisturizers, and oily hair products can trigger fungal acne. People try to treat it like normal acne, but salicylic acid and benzoyl peroxide don't help much because the root cause is yeast. Only antifungal treatments work, even simple ones like topical antifungal creams. Last on the list is hormonal acne. Hormonal acne is the type that keeps coming back in the same exact areas, like the chin, jawline, lower cheeks, and sometimes the neck. It's deep, painful, and pops up around hormone fluctuations like stress, menstrual cycle, or changes in sleep and diet. These pimples feel sore before they're even visible. They often start as nodules or cysts, then slowly come to the surface. Hormonal acne is linked to oil glands reacting strongly to hormones like androgens. That's why teenage years, early 20s, pregnancy, and high stress all trigger it. You can manage hormonal acne with lifestyle, stress control, retinoids, and consistent routines, but some cases need prescription medication. The important point is, hormonal acne isn't random. It follows a predictable pattern tied to your hormones. So, those are the 8 major types of pimples. Each one forms differently, behaves differently, and needs its own approach. When you understand what kind of breakout you're actually dealing with, you stop wasting time on the wrong products. You avoid making the problem worse, and you start treating your skin the way it actually needs to be treated. Acne isn't just one thing, it's a whole spectrum, and the more you recognize the patterns, the easier it becomes to control. And if you want more clear, simple skin explanations that actually make sense, make sure to hit subscribe so you don't miss the next one.